talked about today with the CEOs of many companies is about where is healthcare reform today, where is it going, what can companies do to really address their concerns about cost of healthcare, ability to provide insurance coverage for their employees, how do we look at changing the models. And what we talked about was what's in the bill and what can be improved upon. And what it came down to is, one, we needed to have healthcare reform. We have to be able to change the way we're doing healthcare delivery today, because it is costly and we've got to bend that cost curve. It's not sustainable. How we can do that is through a change in the way in which healthcare is reimbursed and put more emphasis on prevention, more emphasis on wellness and quality. Pay for value, pay for outcomes, and incentivize our employees and the people in the community to take responsibility for his or her own health and to work on the prevention and wellness and recognize that as a way to help lower the cost. It's also about how do we deploy information technology and information systems to make it better for the caregivers and make it better for the patients. And we can take out a lot of the inefficiencies if we do put in standard order sets, standardization, the electronic health record, computerized physician order entry, so that we are preventing mistakes and mislabeling. There's a lot of ways that we can leverage technology and information systems to really drive out some of those inefficient costs. And I believe that as we move forward, we are going to have to see healthcare reform as it is today somewhat tweaked and modified in order to improve on what's been passed. Obviously, there's a lot of discussion about will it be repealed. I don't believe it's going to be repealed in totality. I think what's going to have to happen is we've got to really reevaluate where we are, and as we write the rules and regulations, how can we create these new models of care that focus on prevention wellness? How do we get the individual patient engaged? Patient engagement is very important. Individuals taking, again, responsibility for his or her own health and in managing the health of the entire population. And that's where they have the opportunities through programs like the Accountable Care Organization. Again, coordinating the care so that we know the patient is getting the right care at the right time, in the right way, in the right amount, at the right price, and that we can prove it.